you very much. The race to find a vaccine against COVID-19 is gaining pace. In South Africa, hundreds of health workers are being given a century-old tuberculosis vaccine to test whether it can protect against coronavirus. Trials are also underway elsewhere, including the Netherlands and Australia. If effective, the vaccine could be a vital weapon against the virus.
It's just a small puncture, but it could make a huge impact on tackling the COVID-19 pandemic. That at least is the hope of researchers who this week began a vaccination trial in Cape Town. The team around Dr. Karen Upton wants to investigate whether the tuberculosis vaccine BCG can reduce the severity of coronavirus-related symptoms. The reason behind it? Researchers have experienced positive so-called non-specific effects of BCG in the past.
Babies, adolescents, the elderly, there have been a reduction in the number of respiratory tract infections in individuals who receive the BCG vaccine versus the ones who do not receive it. So that's a very interesting non-specific effect.
In order to investigate this further, a minimum of 500 healthcare workers will receive a shot in the coming weeks. Half will be given the actual vaccine and the other half a placebo. Through follow-up phone calls, the researchers will determine the health condition of the participants and so the effect of the vaccine. The trial is conducted and funded by TASK, a clinical research centre based in Cape Town. CEO Andreas Diakon says the speed of the results depends on several factors.
It will depend on the speed of the epidemic. So the more cases we have, the faster it will be to prove the protection. And it will also depend on the number of cases we can include. So the more people we can include, the bigger the chance to find a signal early.
The next big challenge for the researchers is to secure additional funding. But Andreas Diakon is optimistic.
I'm excited to start this trial. It's not basically because I expect a certain result, but I see a positive energy in my team and also see a lot of positive energy in the healthcare workers that we want to vaccinate, just due to the fact that we're trying to do something that might actually work.
If it works, a lot of people could profit from BCG. A dose for 10 people only costs a little more than $2.
But will it work? Let's bring in Luke O'Neill. He's Professor of Biochemistry in the School of Biochemistry and Immunology at Trinity College, Dublin. A month ago, you predicted that BCG could be the first approved vaccine for COVID-19. How did you come to that conclusion?
Yeah, there's great excitement around this one because, as was said in the interview there, we know that BCG protects against other viruses. So, for example, respiratory viruses in your lungs. There was evidence that BCG somewhat mysteriously could protect. It's a mystery because it's a vaccine for TB, which is a bacteria, and yet here there was evidence of against a virus. So as soon as COVID-19 came along, people thought, why not give it a go with that? We know it's very safe, it's in millions of people, so it's provoked 7 separate trials are running at the moment, and we're very keen to see those results.
Well, the World Health Organization says there's no evidence whatsoever that BCG protects against COVID-19. How hopeful are you about these trials that you just mentioned that are currently underway?
Well, of course, that's why the trials are running. We still don't know, remember, and the WHO can be cautious for good reason, I guess. But given these previous studies and given the science behind it, we're optimistic. And one big thing it does is it kind of puts up kind of a barrier in your body that bounces off. Many germs can bounce off, not just TB, of course, and there's good evidence for that. And there's 20 years of science behind this idea that BCG might have these effects. That gives rise to our optimism, I guess. But the trials have to run. Like most things with COVID-19, we've got to test it now in a proper way. And that trial in South Africa, there's 2 in Holland, there's 1 in Australia running as we speak, so that those trials should give us the answer.
How dangerous is it if we pin our hopes to one sort of left field method to beat this virus?
Yeah, well, we can. I mean, obviously, this virus, there's many different things being tried. We're at least a year away from a vaccine, so that's quite a time to go. This could be a bridge to that vaccine. Meanwhile, there's antiviral drugs being tested, anti-inflammatories. This is one of many different approaches. All we have to have happen is one has to work, and then we're going to make a difference. And this is yet another shot on goal, is the phrase we use here. So again, it's another go where there's reasonable science behind it, but these trials have to be done to see if it's going to work or not.
Immunologist Luke O'Neill from Trinity College, Dublin. Thanks for joining us.
Thank you very much.